Good morning, everyone. Thank you so much for tuning in and joining in the conversation about the transformation of mental health, the transformation of health, the transformation of services, as we are also beginning to look at the language around this, and it really being about how service delivery is and what and how we're communicating about service delivery and people's access to the services that they want to be a part of and that are for to enhance their own well-being and that they choose to be in. So the transformation is so multifaceted in terms of what it is that we're talking about. And so we've looked at the transformation of mental health. We've looked at the transformation of health. Now we're sort of considering this idea of it really being more of a transformation of service provision and how services are, how services are accessed in whatever that means, and it being in a single point of access for all individuals, so that it really is more of a trauma-informed conversation in terms of what happened instead of what's wrong, and it being more about what do you need instead of do you qualify, or what do you qualify for. And so those are some of the conversations we've been in, and we've and in looking at that, as we continue also in today's conversation, using Unveiling the Strengths of Social Workers as our platform to have this conversation. Part of it, where we are right now, is this idea of social workers being holistic problem solvers, which is right here. And social workers possess a holistic approach to problem solving. They recognize that challenges faced by individuals and communities often have complex, interconnected roots. And I think that's one of the important things for us to be looking at in service provision, and how services are often, and I think we've all, as clinicians, all had these experiences before where services are siloed. And so they're not connected, and they certainly don't, and service providers don't speak to each other. Certainly when I did case management for, over 15 years, and I love doing case management. It was one of my favorite parts of my job because of the ability to look at that whole picture and see what was missing, what was the gap, what was not being addressed, who wasn't talking to whom, and being the conduit myself to collect all the information, be able to say, well, A is doing this and B is doing that and C is doing that. And so let's come together here and have a conversation with our participants, so that we have a better understanding of what it is that we're all doing, and there isn't, it's not quite so fragmented. So I think that the systems that have been created, of course, don't acknowledge the complex and interconnectedness of people's lives. And even if they're not necessarily challenges, they're still complex and interconnected, right? So by addressing not only the symptoms, but also the underlying causes, social workers create sustainable solutions that promote long-term well-being. And, and where I believe that to be true, and that I think, for me, where I stand right now, this seems more of the capacity of what we are capable of, certainly what many of us have done, and also living in and existing in a system that does not permit a whole lot of opportunities for there to be sustainable solutions. And having those sustainable solutions, and sustainable solutions that are long-term. And I think, I think part of it really ends up being about the moving away from, and this is part of, I think, the culture of service provision is the tendency to do for. And so things are not sustainable, and then they can't be long-term if we continue to not teach people how to do for themselves, so that they can be, so that they have the skills and the knowledge to be able to maintain whatever it is that they want in their life, that when they are confronted with a circumstance or a situation in their life, that they have the skills and the tools to be able to manage that situation and move to the next piece of their life, or be able to tolerate perhaps the challenge of that situation as it works itself out. And I think the culture of dependency in the mental health system prevents us from being able to really effectuate that the way that I think that we truly want, in terms of creating or supporting our clients in creating sustainable long-term solutions for themselves. So I'd love to hear your thoughts about this, and join me next week as we continue in that conversation.